Treating shoulder cases doesn't have to be hard, but it does require a lot of critical thinking. Now, I think it's very important as occupational therapists that treat hand and upper extremity injuries to really dive into knowing how to treat shoulders, because you're going to see that there's a lot of cases where you're treating hand, wrist, elbow problems that all stem from the shoulder. Now, this is also important when you're studying to become a certified hand therapist. Shoulders, understanding how shoulders work, the nerves that go to shoulder, all make an impact on, again, the hand. And so it is included in the hand therapy exam certification. Now, as a therapist, if you want to learn more about shoulders and how I teach shoulders, not just inside my therapy clinic and how I treat, but also how to study for it when it comes to the exam, click the link below. I've got several different courses that can help you become a more complete therapist. This is a case that I was discussing with one of my therapists as she was studying to become a certified hand therapist. Check it out here.
Let's talk through this case, right? Because everything goes back to anatomy and nature of injury, right? And in order to treat, you have to know your anatomy, but you have to know the nature of the injury, right? Nature of injury, nature of disease, right? So, this is thoracic, this is lumbar, right? And then here are your scapulas, right? And then here are your, pelvic bones, and then your legs and your arms. And you have a very sad Asian person. Right? So if everything goes back to anatomy, and we have bones, we have muscles and tendons, we have ligaments, we have nerves, and then we have skin and fascia, right? Now, unless there was a surgery or something like that, I'm kind of not going to really pay attention to this right now, even though this always affects how the arm and the body in general moves, okay? So we know from a bone perspective that there is absolutely no injury to the bone, that structurally everything is in place. What we do know about the bone is the nature of the disease and the nature of the injury. Now, surgically, we have potentially stenosis. We have potentially osteophytes, which now we know is bone growth, right? So we have the bone stuff here. Supposedly, it's thoracic as well. It's very rare that you have stenosis in the thoracic area. Not that you can have stenosis anywhere, but it's not that common. Like mostly stenosis is the narrowing of the canal, right? And then osteophytes are just, kind of like extra bone growth in certain places. Certain places it causes more problems than others, right? But for the most part, let's just assume that they're there, but they're not necessarily stopping anything. Because sometimes people feel pain and symptoms, not because of those things, but because muscle, tendons, and all that stuff gets tight. So if someone decides, if two bones hold together, right? So if you think about the stack of cervical bones, there's 7 of them, all right? Imagine 7 of them all stacked together, and you get scared to move. Just imagine the hands, right? If this joint and this joint and this joint and these joints are all stacked upon each other, and someone tells you if you move, you're gonna die. If you move, you're gonna become paralyzed. What do you think is gonna fucking happen? The person's gonna stop moving. Guess what happens? Ligaments that hold bone and bone together get tight. They no longer have the flexibility because they give stability. Now they overgive stability, right? Muscles and tendons crosses joints in order to move a joint, but if you stop moving, what happens to your muscles and tendons? They get tight. They become inflexible, and they get tight in very particular places, right? So based on the anatomy of that particular muscle and that particular tendon, based off of what its main job is now no longer going to do the job really well, correct? And so we think about all the muscles of the neck, the chest, the shoulder complex, everything, right? All of that is connected down to the back, out to the arms. Like, I didn't make this shit up. This is how you're created, right? Now, we also know there is, this person came in for very specific nerve issues, right? That there is a quote unquote nerve injury that is, we don't know, kind of came out of nowhere, right? So nerves, here's your brain, right? That then is connected to all of these nerves that come out, right? So then there's a few of them that come down the arm, correct? So we know that nerves is one of the key players in the nature of this particular injury. Then we have to then look at the nerves. Now, we already identified that there is a wrist drop, right? If we know that there's a wrist drop, we can then work backwards and identify that this is a radial nerve, right? But a radial nerve can be at the shoulder, right? I'm going to put this shit a little bit higher, right? It could be, let's say, at the elbow, right? So we'll say this is elbow, we'll say this is shoulder. And it also could be at the neck level. So anything, what do we know about nerves, right? The fact of the matter is, when it comes to nerves, the nature of the nerve is that wherever you have the injury, right? If the injury, then the symptoms are distal. Correct? So we can say, well, the symptom is at the wrist. So we have to look at the elbow, we have to look at the shoulder, and we have to look at the neck. So we keep treating only at the elbow, we're not going to get results, which we haven't. We're treating at the shoulder, we're not necessarily getting results either, right? So we really need to look at the neck too, right? Now, the shoulder is affected by the fact that the whole arm doesn't move as well, right? Correct? So the shoulder, now we know, has a particular issue with how the scapula moves, correct? Mm-hmm. So now we know, well, there isn't just a wrist drop, there is some form or fashion of scapular weakness, correct?
Yeah.
There's a lot of scapular muscles. What muscle is weak? What muscle is not working?
For her?
Yeah.
Serratus anterior.
Okay, serratus anterior. All right, so now we know that the serratus anterior is now working. So what happens when the serratus anterior doesn't work? Okay, so what you're describing is a symptom, which is fine. We have essentially, is it winging or is it tipping?
No, it wings out.
Okay, so it wings out. Does the muscle work at all, or is it weak, or like what's going on?
I think
Let's
it's
do a
weak.
manual muscle test.
I think it's weak.
Okay. Is it a 2? Is it a 3? Is it a 4?
No, it's not any of those. It is like a 2 minus.
Okay, so it's very weak,
It's very
right?
weak.
So then we think, well, if the serratus anterior is weak, who is now stepping up to the plate? If you look at a whole team of people, and you're always broken down by your weakest player, right? Whole fucking team, great. You got bring in one weak player, and then the whole thing crumbles. Serratus anterior is that weak player. So now, because the serratus anterior is not working, who is left to be working? Who's working so hard because the serratus anterior is not working? Because this is a team sport.
Everyone. But
Who is everyone? Be specific.
would you then say, yeah, all right, then it'll be like your rhomboids, it'll be your traps. No,
Okay, your traps.
upper,
Yeah,
and your eliminator.
yeah.
Because those are the only ones I can think of
Right. So what you then look at is you look at the scapular positioning, and you look at everyone's job, right? You look at everyone's job. So let me go ahead and erase this, and we're going to break down the shoulder, right? We're going to break up the anterior to the posterior, and then the middle, right? So we have to go and we have to say, who's working and who's not working, right? Because what we have right now currently is the scapular head down, ass out, right? And not only is she forward, so her ass is sticking out, but she's like rotated, right? So she is abducted
Mhm.
versus being adducted to be somewhat aligned along that thoracic wall, right? So she's lateral, so she's got that what we would call externally rotated in a very, whatever specific, if you're gonna get real specific talk, very externally rotated, anteriorly tipped, right? If someone is anteriorly tipped, that's why they are winging or tipping out, right? So she doesn't just have winging is like this.
Yeah.
She is tipped. If you look at her scapula, she has both, right? But tipped is more. The winging is like more out like this, but you totally see her inferior angle. And it's because her superior angle is nosedive down, right? But she does have that abducted look. So what happens when the muscles are working out of balance? When the muscles are working out of balance, it's going to affect, no doubt, your ligaments, right? So we have to identify which muscles are overworked right now, which are the two. Name two. There should be two that are very obvious.
No any right now. Can you guess her pecs because I said it earlier?
Close. Her pec minor is working the shit because the pec minor is attached to a coordinate process that is pulling the head down, right? What else? You said it earlier. Say it again. Say it loud for the people in the back.
No, I don't know what I said.
The fucking traps. It's not any trap. It's the upper trap.
That's not under the post. Okay.
That ball that you're seeing, that is the upper trap, along with some other, I'm sure, other neck muscles that are like this, right? Because you have your upper, sorry, that's not really anterior. sorry. Well, it's, upper trap. Posterior. So her upper trap is overworking, her middle trap and her lower trap not working at all, right? Not working at all. So, and then a lot of times their deltoids working, like overworked, their biceps overworking, right? So you got a lot of muscles. I mean, we can talk about those muscles all day long, but you just want to kind of identify a few that are working, not working, right? Because somebody is pulling her forward like this, and somebody else is not pulling her back. Because for muscles to be balanced, you have to be able to give and take, right? If your biceps is constantly working, your triceps does not work, that's called tone. You're stuck like this, Chuck, so for muscles to work, for movement to occur, there has to be a give and take balance between the two. And when that doesn't work, what is tight? What is tight? Yeah, I already told you that. Get specific. I'm gonna yell at you like I yell at Pia. Always like, get specific.
That's fine.
Specifically, what part, like what ligaments get tight? If we have a circle that is our capsule of our shoulder, what gets tight?
All of them, Juan. The lower ones, the inferior ones, the anterior ones, the posterior ones, all of them get tight.
Yes, but which ones are worse than others if she can't lift her fucking arm up? And she keeps going like this.
Her inferior ones?
Inferior, what else? What else? It's posterior. Because why? Because the fucking pecs and everything is pulling forward. And so, but who's pulling back? Nobody. Right? So posterior capsule tends to get tight. Why do you think she's constantly trying to stretch? She's like, oh, I do this, right? The thing is, if you're out of your socket and you stretch, what happens? You perpetuate the fucking problem. So it's like, oh, it feels good for a second, but then you're not put back into your socket and made for certain muscles to work, right? Now, this is what happens. This whole scenario happens, right? All day, every day. We haven't even gotten to the stupid neck yet. So when you're running out of things to do, it's not that you run out of things to do. It's that you want to do new shit and you can't because just they're not doing what they were supposed to do in the first place, right? So you have to find, if you want to get results, you have to have the hard conversations of what the fuck are you doing between sessions? Well, I lay on the foam roller and I go like this. What are we working on? What muscles are we working on? Working out all the ones that are already tight. Okay. All right? I know that feels good because you know it, right? But if the exercises that she's doing at home cause that ball called the upper trap to overwork because it is going to constantly work and compensate for the fact the muscles back here don't do their job. Somebody is sitting on the job and not doing it, right? So the one who's working will continue to work more because that's just how it happens, because they can't sit out of the game. Unless the power gets turned off, right, even further. So if you want to look, then you have to go and say, okay, well, I can keep doing these shoulder exercises and working on these imbalances, but gosh, I've been working on them and they don't seem to help. So if you've worked on the wrist or the elbow and you've worked on the shoulder, then what have you not worked on? Why? Why are we not working on the neck?
Because I'm scared of stupid stenosis and
Well, we already talked about that. But her fear has become your fear. Go do some research on stenosis. And that you'll find that a lot of times people have stenosis, but still need to move, right? Still need to move. There is nothing in the movements that you're doing that is uncontrolled. You're not a chiropractor going and taking someone to end range and thrusting. So there should be no harm, right? Because if you understand your anatomy and you understand your technique, right? It shouldn't have a problem with safety. Where's the safety issue? You have to be careful. If you want to make progress, you can't absorb the fear that they have. Someone put it in their mind, don't move. Well, this is why we have the problem that we currently have. Because we want to be working like this. Now, we do know that if we move here and we move here and we move, that it will loosen here. If we work a little bit of the lumbar, we work some of the thoracic, then the cervical will loosen up too, correct? And then when we do that, then we don't have to work that hard on the cervical, because the cervical doesn't need to be worked on that much, but it has a lot of muscles. And the muscles could be worked. There's a lot of fear around stenosis, but when you're working on something, how do you know that it worked or didn't work? Your technique or your movement or your exercises. How do you know it worked and didn't work?
based off of feedback. That's what I've been basing mine on.
Based off of feedback, but what else?
Like results, if she can keep them.
Yeah, so based off of like what you see, right? So when you do a clinical test, you either see it get better, not get better, or get worse. So that's how you are able to depict and see what works and what doesn't work. Stenosis is very much like that, just like anything else, right? If you do chin tucks, you're not taking the bone and taking it completely off of each other and now she's paralyzed, right? There is no realm in the world that when you do chin tucks that happens. But your job as a therapist is to help someone get over their fear of movement. Like you already know how to do that, because every single time someone comes in, DIP, PIP, and MP don't work. Well, you know that it takes time to help them feel less fearful of moving it. If someone comes with a flexor tendon, you know what to say, okay, well, we're going to move it like this, and this is very safe because I understand how tendons work, right? So the same is the same. I said that incorrectly. It is the same for stenosis. A cervical spine is literally like C1, C2, C3, right? They're all stacked on each other. And when you're doing chin tucks, you're actually just moving the lower cervical into some extension. And if she looks down, then she's going into some flexion. And if she looks across, like she looks like this, then she's doing a little bit of rotation. You're not completely rotating one bone off of the other bone and cutting the spinal cord, right? But that's what people imagine happens, right? Because someone put a fear into them and said, well, if you have stenosis, you really shouldn't move. I'm not asking you to push someone into such painful end range, but in order to see how the symptoms can improve or not improve is to take someone through end range. We're not thrusting, we're not pushing so far into end range that's causing pain, because you'll feel it. You'll feel it. They'll feel either pain or they'll feel more numbness, but every single time you worked on it, it's like, oh my God, I feel like there's blood flow rushing to my arm. But then why isn't she doing more of that over and over and over again? Why is that not repeated over and over and over again every single time she comes to therapy? And she's not coming that often, right? So, hey, listen, I know you're not coming to therapy that often. It's okay. Don't make them feel guilty for not coming. But if you're not going to come, this is what I need you to do, because I would love to see results for you. Like, I'm so committed to getting results for you, right? So I know that this feels good, but the thing is like every time you do this, put your finger on the ball and do this. Mine is normal because my shit is even, right? But you go and feel it, and oh shit, it's a lot of work for my neck muscles, right? Let's not go into the neck muscles right now. I'm not gonna dive into the anatomy of neck muscles, but it's all fucking related. That is the critical thinking, right? So that you can feel safe knowing what you know, that you're coming in because you have a nerve entrapment right around here between your neck and your shoulder. It's called the brachial plexus, right? And how it's presenting is all the way down. Now, what we know is it's slowly recovering because this muscle came back, this muscle came back, this muscle came back. So we know something is happening, right? But now we need to work on the muscles that are not there, right? Because if it's not coming back, your ligament is going to just stay tight all the time. And it's hard to stretch it out yourself, right? You can work on it. What are some stretches? It could be active, it could be passive, right? Passive stretch is like, oh, you lay down, you gotta gravity pull you, right? But then when you gravity pull, you gotta use your muscles to come back, you know? But then you can do active, which is this. Move your scapula, right? Roll that thumb out, move your scapula, roll your thumb in, which one, you know? So there's a lot of techniques you can use. You want to use mine, use mine. Oh, let's work into ease versus restriction. From an exercise standpoint, if you like weights, let's do it with weights. Here's the position with the weights. Oh, you like the foam roller? What do I have to say about the foam roller? Because sometimes that makes things a little worse. But there are a couple of things you can do with the foam roller that's actually quite effective. We would have to explore what that is, because if you like the foam roller, I'll show you a couple of things on the foam roller. I like to find things that people like so that I could like get them to do it, right? If they don't like it, if someone doesn't like bands and all you're doing is giving them bands, they're not going to fucking do it. But if they like to go to the gym and they like to do weights, then I like to find one or two things. Like, before you get started there at the gym, can you do this one thing for me? Before and after, just do it, right? I don't care what else you do. You know, sometimes that works, sometimes it doesn't. Right? But when you explain it to people, like, look, we've gotten better. We've gotten this better. We've gotten the hand a little bit better. Have we not? We're seeing improvement in the wrist. Have we not? We just haven't been consistent because, hey, your shoulder, between your neck and your shoulder, keeps getting crushed. It's a compression injury, right? Nature of injury. When it's compressed and then release, compress and release, it feels good sometimes, and then it doesn't feel good all the time, and then it feels good sometimes, so that's a compress and release shit that's happening because of anatomical structures, right? And I bet you anything, she's like this, like the rest of the world, right? But you could just do one thing, She's doing thoracic extension all the time. How often? It's very repetitive. I'm sorry. I know. It's very repetitive. I fucking hate it for you too. I hate it for myself. It's very repetitive. If you can just do 5 of them, 5 is better than nothing, right? And then when you do 5 of those, then you do 5 of these. Chin tucks. Talk about it, right? And you just gotta build it into your day. Because while you have the injury, the more we can do it now is the best. And then as you recover, you don't have to do it as often. It's your job to help someone understand at this level that they will listen to you enough. I mean, you could be really good and people cannot listen to you. And that's okay. But I go to bed at night knowing full well I said the thing that I was supposed to say. And I feel really good about it, and you should fucking keep coming in. Because you're not doing it. So let me hold you accountable, right? If you're not able to do it, come in more often. I would love the opportunity to continue to help you, right? Why do you think some of our patients come in? Therapy takes so much time. Your fucking hour here, it took you 30 minutes to get here and 30 minutes to get home, if you're lucky, all right? But people come back because they're bought in by what you have to say. But if you're scared to say it, then you won't get anywhere. What questions do you have?
Besides chin tucks, what else can you do?
So once chin tucks get better, then you do chin tucks and extension, right? So I always like to go in the order of thoracic extension and then chin tucks. And then extension, right? And then you have to work on some core neck muscles, right? So sometimes people do it standing up. Isometric, because you can't, these are gravity eliminated while you're standing. They're gravity eliminated while you're standing, right? So your neck flexors tend to be very weak because they are gravity eliminated. So how do you make them work? You have to either be supine, so it's like a little upper ab, or just lifting your neck up, right? I can't properly demonstrate it here, but some people do it with they put the band across and they're like, have you seen that?
Never seen that. So we're doing neck flexors.
Yeah. Who was it? But you can work, you have to look up little like neck muscles. There's this too where you push, this is isometric. Oh shit. Oh, my muscle's a little weak there. But it's like you're gonna push back, all right? And you push back into that. So you have to make sure that you're not compensating with your body.
Pushing
So
back. That's like another chin tuck?
No, but it's isometric.
Okay.
Chin tuck is getting motion.
Okay.
Right?
Uh-huh.
It's okay. Chin tuck's getting motion. Isometric is engaging the muscle, right?
Okay.
Okay. Like there's a few of them, but those are some. You can do it in supine. Coming up. Some people. What was it? Oh, they hang on in a prone position and then they lift back. So then it's gravity eliminated. So you just have to look at some of those neck muscles, like look at some of those neck exercises. I personally don't necessarily, like me personally, I don't necessarily isolate neck muscles to work on. I do a lot more functional stuff that engages the neck that then get me what I want, right? So I'm not working with people with like neck surgeries in particular or whatever, but yeah, there's a, you know, when you're working on shoulder exercises, just engage the neck in a certain way. Upper abs engage, you can engage the neck a certain way. You know, there's a lot of different ways that you can do it, but you have to get, it's in every joint, right? You have to get more motion before you have to get more joint motion before you want to get more like strengthening of the muscles, right? If you have this much motion, and then when you go to do the strength, you're only strengthening the muscle here, but the whole joint actually moves this much. And so you have like all this amount of muscle that's not getting strengthened because you only have this much amount of motion at that joint level. So you have to get more motion and then follow up with strengthening. If you're doing shoulder exercises, you've got to put her into her socket, position the scapula, and then ask her isometrically to engage those muscles, right? So I'm trying to do serratus anterior, you know, and I'm trying to get, you know, some of the other muscles, the the middle and lower traps, or the subscapularis, you know, anything like that. If I got to put her scapula, I've got to put a humeral head more posteriorly, and then I might have her do some abduction to then engage those scapular muscles, right? But if she's out of socket, I'm like, okay, do adduction, then she's not in alignment in order to engage the muscle in the way it's supposed to be engaged. And so in that sense, she would continue to strengthen in an abnormal, not abnormal, in a, how do you call it? Kind of like an abnormal position. I don't want to say it. That's not the right word, but you know what I mean.
Yeah, incorrect.
Yeah, incorrect position, basically. And so then the strengthening then perpetuates that same positioning. Versus if you put her into the position first and then she strengthens, and then you would continue to strengthen in that position, right? So if I'm doing internal and external with her, right? If I do internal and external rotation, external rotation is for sure going to engage the serratus anterior, especially with biceps up, right? So if I let her do her external rotation with her scapula like this, it's not going to work. But if I manhandle her scapula and pull her into the position I need her to do, and then she does it, even though I'm handling her, at least it's going to allow me to see if she can do external rotation. And then I'm going to show her, she has to start to feel like this is where my scapula belongs, right? Otherwise, she's going to feel like it's like this, and that this is her new normal, but it's not. And it creates that ball in her shoulder, right? Any questions? Does that make sense?
Yes, that makes sense.
So what'd you think about that video? There was a lot to unpack in that video. We talked about nerves, we talked about shoulders, we involved the spine. Yes, there was a lot of information in there, but what did you think about it? Leave me a comment below and let me know what questions you have. Now, if you like videos like this, click the like, subscribe, and follow me for more.